Dr. Emily Carter says this isn't something most men hear during a routine checkup, so she'll be completely honest. If a man has stopped masturbating in his later years, his body may be deteriorating quietly, and he might not even know it. This is not a taboo topic or locker room joke. It's a physiologic reality supported by clinical evidence, and ignoring it can have serious consequences, not only for sexual health, but also for mental clarity, cardiovascular well-being, sleep quality, immune strength, and even a sense of identity. With more than 2 decades devoted to studying how the body changes with age, especially intimacy, hormonal balance, and long-term vitality, Dr. Carter has seen one of the most common invisible threats. Too many older men abandon their sexual health, and with it, they lose a fundamental key to overall well-being. What may surprise many is this: masturbation isn't a leftover impulse from youth. It remains one of the most powerful tools an aging body has to regulate hormones, protect the prostate, support brain function, and counter low mood. If a man has stopped or never adopted this habit, the cost may be far higher than he realizes. She then guides viewers step by step through what happens inside the body when masturbation disappears from daily life, information that could permanently change how men view their health and themselves. Before diving in, she invites viewers to share where they're watching from in the comments. She begins with the first and perhaps most underestimated consequence of not masturbating in later life: what it quietly does to the prostate and urinary health. 1. Decline in prostate health and urinary function. When Dr. Carter began practicing urology about 25 years ago, she didn't expect so many patients to open up about something so personal and so vital to health: the gradual disappearance of sexual habits in later years. She vividly recalls a patient, a 73-year-old retired gentleman she refers to as Mr. Frank, who told her, "Doctor, I thought that part of life wasn't necessary anymore." He was active and otherwise healthy, yet he woke up as many as 5 times a night to urinate and couldn't understand why. What Mr. Frank didn't know, and what most men don't realize, is that regular ejaculation, even through masturbation, plays a crucial role in healthy prostate function. The prostate isn't passive. It's a living, dynamic gland that produces seminal fluid and naturally expands and contracts. Like any biological system, it suffers when neglected. Without regular stimulation and release, prostatic fluid can stagnate, creating a setting for inflammation, swelling, and eventually pressure that interferes with everything, from urination to sexual performance. Dr. Emily Carter explains that men may feel a heavier bladder, a weaker urine stream, or that uncomfortable sense of not fully emptying. These aren't mere annoyances, they're early warning signs. The most concerning part is that chronic prostatic congestion can quietly escalate into more serious conditions like benign prostatic hyperplasia, BPH, which affects more than half of men over 50. Left untreated, BPH can lead to urinary retention, bladder infections, and, in extreme cases, the need for a catheter. She recalls the patient she mentioned earlier, Mr. Frank, who ultimately needed surgery to relieve pressure, something that might have been avoided with simple, consistent habits addressed earlier. Regular ejaculation helps flush the prostate, clearing old fluid and reducing bacterial buildup. In fact, several studies have shown that men who ejaculate 21 times or more per month have a significantly lower risk of developing prostate cancer than those who do not. She is very clear. This is not about trying to relive youth or encouraging obsessive behavior. This isn't about fantasy, it's about function, using biology to protect the body in the most natural way. When masturbation stops, men aren't just foregoing pleasure. They may be risking pain, inflammation, and a gradual loss of control over one of the body's most basic functions: urination. Dr. Carter has seen men become afraid to leave their homes because they don't trust their bladder, and strong, proud men suffer sleepless nights and daytime anxiety over a condition that might have been prevented by something as simple as regular self-stimulation. There's also a mental cost. Losing control in this way, mapping every outing by where the bathrooms are, dreading long car rides, waking every 2 hours, chips away at independence. This isn't just about the prostate, it's about freedom. What starts in the prostate doesn't stay there. The next consequence, she explains, affects not only the body but the brain, and once it begins, it can alter how a man thinks, feels, and remembers. 2. Cognitive fog and reduced mental clarity. Not long ago, a 62-year-old patient, she'll call him Richard, came to her office. He didn't complain about his prostate or energy levels. He simply said, "Doctor, I don't feel like myself anymore. I walk into a room and forget why I went in. I lose my train of thought mid-sentence. I used to be sharp. Is this just aging?" She hears this more often than most would expect. Yes, aging brings some natural cognitive changes, but what many people, even well-educated, health-conscious adults, don't realize is that sexual activity, including masturbation, plays a powerful role in protecting brain function. During self-stimulation, the brain releases a neurochemical cocktail, dopamine, serotonin, oxytocin, all directly tied to memory, focus, and emotional regulation. These chemicals don't just feel good in the moment, they help build and protect neural connections, increase blood flow to the brain, and reduce cortisol, the stress hormone that, in excess, can damage brain cells. Now, when a man stops masturbating, especially for a prolonged period, those natural brain protective chemical surges become less frequent. Over time, mental sharpness can dull. Concentration, information processing, and even motivation can slip. It doesn't happen overnight. It creeps in. First come the forgotten names, then the day of the week, and soon he starts doubting his mind entirely. And in that doubt, fear can take root. Dr. Emily Carter has seen patients slide into anxiety and depression simply because they believed their mind was failing when, in reality, the brain was starved for stimulation and chemical balance. For men, there's an additional hormonal shift. Testosterone, deeply tied to memory, decision-making, and vitality, can decline faster when sexual activity drops to near zero. Testosterone isn't just libido, it's identity, strength, and clarity. Frequent, healthy ejaculation can help support and preserve testosterone levels with age. Some studies have even begun to link reduced sexual activity in older adults with early signs of cognitive decline, including dementia. Dr. Carter is clear. She isn't saying that stopping masturbation causes Alzheimer's. She is saying this: when the brain is deprived of stimulation, emotional release, and hormonal support, it grows more vulnerable. It loses rhythm and resilience. For many, the fog grows dense enough to change how they live, interact, and see themselves. She recalls one man who stopped going to his chess club because he couldn't focus on the game. Another, a retired professor, confessed that every morning felt empty. These weren't memory problems needing medication. They were symptoms of a life disconnected from physical intimacy, even with oneself. The tragic part, they're avoidable. No pills or costly therapies are always required. Sometimes the solution begins with reconnecting to the body, giving it the attention it quietly craves. Because when the body is stimulated, the brain wakes up. But cognitive dulling is only part of the story. What happens next, when emotional balance begins to erode and mood quietly sinks, can be subtler, more damaging, and far harder to discuss. Dr. Carter explores how giving up self-intimacy can quietly invite depression into a man's life. 3. Increased depression and emotional numbness. Dr. Carter once met with a 71-year-old widower, otherwise healthy, who didn't come in for a physical complaint. He looked her in the eye and said, "Doctor, I don't feel anything anymore. Not sadness, not joy. I'm just flat. Is that normal for someone my age?" She hears variations of that question all the time. What many assume is just getting older. The monotony, the disconnection, the slow fading of emotion often has a deeper physiologic cause that few want to mention: the loss of sexual stimulation, particularly self-stimulation. Here's the truth. When men stop engaging with their bodies in a physical, intimate way, their emotional landscape can shift, quietly but profoundly. Masturbation isn't only physical. It's also an emotional release, the body's built-in stress relief system. During climax, the brain releases potent chemicals like oxytocin and endorphins, natural mood stabilizers that fight anxiety, tension, and low mood. Remove that release, especially amid stress, loneliness, or grief, and emotional numbness can set in, sometimes evolving into depression. She's watched it unfold slowly. A man stops masturbating after losing his spouse or because he decides it's not appropriate for his age. Weeks turn into months. He grows quieter, more withdrawn, loses interest in hobbies or even conversation. Sleep changes, too much or too little. Appetite shifts, life turns gray. And the cruel irony? Most never see the connection. They blame themselves or their age, assuming this is just how it is now, when in reality what's missing is the simple, essential act of reconnecting with their own body, not just for pleasure, but for emotional survival. Depression in older adults is often underdiagnosed because it doesn't always look like sadness. It can present as fatigue, irritability, detachment, lack of motivation, or lack of desire. While medications and therapy are important tools, Dr. Carter can't count how many patients she's helped simply by encouraging them to reclaim physical self-intimacy as part of a broader, healthy routine. A patient once told Dr. Emily Carter he felt alive again after beginning regular masturbation for the first time in years. It didn't just lift his mood, it reminded him he was still human, not just a body waiting to power down. That small act gave back a part of himself he thought was gone for good. This is what she wants men to understand. Masturbation later in life isn't about fantasy, lust, or shame. It's about keeping the emotional system healthy, giving the body a reason to feel, to release, and to remember what it means to be present. Lose that connection, and a man risks not only sadness, but isolation, emotional atrophy, and in some cases, the will to participate in life. The emotional costs aren't the only ones. As nights grow longer and sleep becomes fragmented, another hidden cost appears, one that can affect memory, immune function, and the risk of serious illness. Dr. Carter turns to how the absence of sexual release can quietly steal the deep, restorative sleep the body desperately needs. If viewers are still with her and find these ideas meaningful, she invites them to type 1 in the comments to show they're here and following along. 4. Poorer sleep quality. She recalls a man in his late 60s, she'll call him Mr. Michael, who came in after months of lousy sleep. He looked exhausted, pale, and frustrated. "Doctor," he said, "I fall asleep, but I wake at 2 a.m. like I've been shot from a cannon. Then I just lie there staring at the ceiling." His tests were clean. No sleep apnea, no obvious red flags. But when she gently asked about his intimate life, he looked away. "That part of me," he murmured, "is over." That part of him, the part he assumed had expired, was possibly the very key his body had been asking for: restorative, uninterrupted sleep. Sleep isn't just closing the eyes, it's a hormonal process, and one of the body's most effective natural triggers for deep sleep is something many forget with age: orgasm. During climax, the body releases oxytocin, prolactin, and endorphins, a chemical cocktail designed by nature to shift the nervous system from stress to rest. At the same time, cortisol, the hormone that fuels anxiety and wakefulness, drops sharply. Breathing slows, heart rate steadies, muscles release, the body enters the ideal state for deep sleep. Now imagine removing that process entirely, not for a night, but for weeks, months, even years. That's what happens when older adults stop masturbating. The body loses a natural tool it once relied on. What fills the gap is often restlessness, frustration, and clock watching. Some turn to sleep pills, others resign themselves to exhaustion as the new normal. But the consequences of poor sleep go far beyond feeling tired. Chronic sleep loss weakens immunity, accelerates cognitive decline, increases cardiovascular risk, and heightens vulnerability to anxiety and depression. In older adults, it contributes to falls, memory problems, and loss of independence. Dr. Carter has seen active, engaged patients quietly withdraw, not because of a major illness, but because they were simply too exhausted to function. Here's the alarming part: many never realize they're missing the one thing that used to help them sleep. Not a medication or supplement, but the body's built-in release valve. Masturbation may seem small, even trivial, but for some men, it's the difference between 4 hours of fragmented sleep and 7 hours of deep, restorative rest. One patient told her that after reconnecting with this part of himself, "I sleep like I did 30 years ago. I didn't realize how much I needed that release. I thought I was just getting old." That's the problem. Too many confuse biologic abandonment with aging and suffer in silence. If a man lies awake with a racing mind, tight muscles, and creeping hours, Dr. Carter suggests he ask himself, when was the last time the body felt fully relaxed, fully let go? Sometimes the answer isn't a new pill or a breathing app. Sometimes it's rediscovering an old rhythm the body still remembers, if allowed. Yet while lost sleep can erode energy and clarity, the next consequence is even more physical. It shows up in weakening muscles, shifting balance, and a bladder that begins to betray. Dr. Carter explains what really happens to the pelvic floor and circulation when intimacy disappears. 5. Pelvic floor weakening and impaired circulation. Years ago, she treated a 69-year-old retired firefighter, she'll call him Mr. James, a proud, physically strong man for most of his life. He came in describing mild urinary leakage, difficulty standing for long stretches, and an uncomfortable heaviness in his lower back and hips. "It's strange," he said. "It feels like the foundation of my body is slowly giving way." What he described wasn't just aging, it was the slow, quiet weakening of the pelvic floor. And he was far from alone. The pelvic floor is a sling of muscles at the base of the core, the same network that supports the bladder, bowels, and sexual organs. Without regular activation and healthy blood flow, both naturally reinforced by sexual arousal and climax, those muscles can decondition. Circulation in the pelvis falls off. The result can be leakage, weaker erections, reduced stamina, and a sense that the body's base is faltering. Dr. Carter underscores that self-stimulation isn't merely about pleasure, it's a physiologic tune-up. Arousal draws blood into the pelvic tissues. Orgasm coordinates rhythmic contractions of the pelvic floor, the very actions that help maintain muscle tone, vascular health, and neurologic signaling across the region. When that routine disappears, the system loses a natural built-in workout. Over time, men may notice more urgency, dribbling, post-void residual sensations, and less reliable erections. Her guidance is simple and practical. Alongside a broader plan for men's health, regular, healthy ejaculation, with or without a partner, can support pelvic circulation and muscle function. Paired with daily walking and targeted pelvic floor work, like gentle bridges and Kegel-style activation taught correctly, many men see meaningful improvements in control, confidence, and strength at the core of their bodies. Most people don't think about these muscles until something goes wrong. Urine leaks, constipation, erectile dysfunction, or discomfort while standing or walking. Here's the part that often gets ignored. Regular sexual stimulation, including masturbation, plays a real role in keeping those muscles active and strong. During arousal and orgasm, the pelvic floor contracts rhythmically. That contraction is a workout, not for vanity but for function. It boosts blood flow to the lower body, strengthens the internal support system, and keeps nerves and muscles communicating effectively. This isn't about performance, it's about preservation. When regular self-stimulation stops, those muscles don't just go quiet, they begin to atrophy. Blood flow slows, tissue becomes less elastic, nerve response fades, and men and women alike may find themselves battling symptoms they never expected. Frequent urges to urinate, a light dribble after using the bathroom, difficulty holding gas, or even pain with movement. For men, that can mean a dramatic drop in sexual function. For women, it can bring dryness, tension, and discomfort that discourages intimacy. Dr. Emily Carter has seen independent adults start avoiding social outings simply because they don't trust their bladder. She's seen others embarrassed by sudden leakage when coughing or sneezing, never realizing it traces back to years of neglecting circulation and muscular activity in the pelvic region. She says this clearly: ignoring the pelvic floor isn't just inconvenient. It can lead to falls, incontinence, and a loss of dignity no one deserves. People begin relying on pads, special underwear, or planning their day around restroom access, all because the body's foundation isn't getting the stimulation and support it needs. And the longer it goes, the harder it is to reverse. What breaks her heart is how many suffer in silence, ashamed, confused, or convinced it's just aging. She emphasizes the body still wants to function, even at 70, 80, and beyond. One of the most effective natural ways to support it, without medication or equipment, is safe, regular, intimate stimulation. Reclaiming that connection isn't only about pleasure, it restores strength, sends blood where it's most needed, wakes up nerves, keeps tissues alive, and reminds the lower body that it still matters. Yet as physical as this is, the next consequence goes even deeper into the immune system, cellular defenses, and the body's capacity to protect against disease. Dr. Carter turns to how sexual inactivity may quietly weaken immunity. If viewers are still with her and find these ideas meaningful, she invites them to type 1 in the comments to show they're here and following along. Looking back on 2 decades of caring for older patients, what strikes her most isn't just the medical challenges. They're the silent, invisible losses people carry. Losses that never show up on lab work or scans. A man who once felt sure of himself now avoids the mirror. A man who once radiated joy confesses he hasn't felt anything in his body for years. Many have been told this is simply what aging looks like. Dr. Carter doesn't believe that for a second, and if viewers have stayed this far, she doubts they do either. Here's the truth as she presents it. The moment someone stops caring for their sexual self, when they abandon that part of their body and identity, a chain of quiet consequences begins. She has walked through them one by one: how prostate and urinary health can decline when regular release disappears, how the brain grows foggy when starved of stimulation, how the absence of physical intimacy can invite depression, blunt sleep, weaken circulation, and even compromise immune defenses. And perhaps, most painful of all, how relinquishing that private connection with one's own body can slowly erode a sense of worth until a person feels like a stranger to themselves. These aren't small things. They're not just aging. They're warning lights, signals that body, mind, and spirit are asking for attention. Dr. Carter has sat across from patients who felt broken, disconnected, numb, and she has seen the shift in their eyes when they begin to reclaim this part of life. It doesn't require anyone else. It doesn't demand youth or perfect health. It requires permission, self-permission, to be worthy of intimacy even now, especially now. She knows this is a subject many avoid. Some feel shame. Others were never taught it was okay to care for sexual health beyond a certain age. She wants them to hear it from a physician who has walked this road with thousands of men. Not only is it okay, it's essential. Masturbation later in life isn't indulgence, it's circulation, mental clarity, hormonal balance, emotional anchoring, immune defense, and identity. It isn't a luxury, it's a form of care, a statement that a person is still alive in this body and still responsible for their well-being. One patient put it best: "I didn't realize how much I missed feeling like myself until I finally reconnected with that part of me." That's the point, not just staying alive, but feeling alive. Not merely surviving the years, but inhabiting them with presence, dignity, and joy. So if someone has forgotten this part of themselves, buried it, judged it, Dr. Carter invites them to reconsider, reconnect, and remember that the body is still listening, still capable, still deserving. Start small, with curiosity and kindness. But start. By choosing to care for this part of life again, a person isn't only protecting their health, they're reclaiming their life. If this message resonated, she asks viewers not to keep it to themselves. Like the video, share it with someone who might need it, and leave a comment below. Whether they agree, disagree, or have questions, their voice matters, and their story may help someone else feel seen.